Hi, everyone. This is Kimberly Miller, and I wanted to record a quick introduction into Healing with Excellence, what Healing with Excellence is, and how it's different than most of the professionals or practitioners you've been to when seeking help for your health. Because a lot of people ask me, well, what's going to be different if I go see Kim or if I work with her international wellness team than the multiple other places I've been to, whether it's been the Mayo Clinic, the Cleveland Clinic, or to another functional practitioner specialist. So I just want to share with you how I work a little bit differently than most professionals do. For me personally, I went through multiple chronic ailments myself, starting at a very young age with chronic sinus infections, amenorrhea, early ovarian failure, chronic IBS, chronic Epstein-Barr virus, heart issues, multiple things. I was told I wouldn't have children naturally. I was told I'd have to live with being constipated 7 days at a time. And so for me, helping individuals heal efficiently, effectively, and affordably is a passion of mine because I went several years suffering unnecessarily. And that was after having like 10 national personal training certifications, doing partial dietetic school. I actually left dietetic school because I was getting the wrong information and I was getting more and more ill. And then after seeing multiple professionals, allopathic professionals and holistic professionals, and still not healing and believing that I was incurable at 32 and 33 years of age. Anyway, I was gratefully led down a different path where I identified the root caused illness and started learning how to heal much more effectively. But that was after losing tens of thousands of dollars in time, money, supplements, and again, losing years of quality of life, fearful that I wouldn't be here long term. So when I created Healing with Excellence, my goal was to teach people the root to what was happening, why they were getting their chronic disease, and to help them heal effectively from the foundation up. Because many individuals are using good modalities like physical therapy, chiropractic, massage therapy, but sometimes it's the wrong modality at the wrong time. A foundation has to be laid, like someone has to have their micronutrient deficiencies addressed, their daily diet, their daily lifestyle, because the body can only work based on what we give it. Or if we're taking in something that we don't know is harming us, like let's say someone has a vitamin A toxicity from their supplements, or they're taking in a food that is not right for their body, it will completely divert or impede the healing process from the other modalities that they're utilizing to feel better. So an individual could feel like they're doing everything right, doing massage, acupuncture, going to their doctor, and still not heal effectively or just be managing their symptoms. So they may believe that this is their fate and this is the best they can get. But really, what's happening is there's missing puzzle pieces to their healing that if those missing puzzle pieces were addressed, they would see a completely different outcome. So when someone meets with me, whether personally or virtually, what we do is we look at their health paperwork. I have an 8-page health history form that I take in. Okay, what have you been through? What's your history? What are your diagnoses? Then I go through what are the different stressors your body is dealing with? What does your daily diet look like? What is your lifestyle? And then there's specific questions on my form that helps me see what type of hormonal imbalances you could have, what micronutrient deficiencies or toxicities you could be going through. And then, of course, I take all of your other data. So if you have any blood work, any diagnostics, any supplements or medications, I look at all of that and I'm kind of like the general contractor saying, okay, this is happening at the wrong time. We need to lay the foundation, then do the framing, then hang the drywall or do the punch out. And all of us, when we're going through an ailment, sometimes we're taking in the information, but this could be our first time going through this ailment. And, we have some mistakes that we make that we don't realize we're making them, or we're led in the wrong direction or down the wrong rabbit hole. What I do is I kind of oversee that whole project and see what practitioners working in the wrong direction for you, what you may have heard is healthy that's not actually healthy and is harming you. And I help you sort through that so it's not so exhausting, time consuming, and that you don't lose time that you don't have. Because again, you're just looking at your body, but I've worked with thousands of individuals. So your expertise gets much more fine-tuned, and something that might take you 10 years to figure out, I could identify in like 10 minutes. So what I do is I look through this paperwork with you. Let me show you. This is just my health paperwork where I go through and I assess the different surgeries you've had, where you're having pain in your body, because everything connects, the neuromuscular system, any kind of issues you're having with like a tight neck, a tight back, constipation, chronic pain anywhere in the body is connected to everything. And then again, I look at your lifestyle habits. I'm looking at specific cellular stressors that are impacting cell renewal. And then this is hormonal imbalances I'm looking for in men and women. And then various vitamin deficiencies that I'm going to screen for. This gives me an idea what the person is dealing with. And then if I need to fine tune that approach, we can order some blood work or get specific labs or diagnostics for them. But oftentimes, just based on experience, I can figure out what's been going on. And by the time many people get to me, they've already had so many diagnostic tests done that they give me those missing pieces. And then I can teach them how everything works together. Because if it's like what I went through, I had all these tests, but then I was never told how to fix it. So great, you're finding a pathology, you're finding a deficiency, or you're finding something that's out of whack, but then nobody could tell me what to do to heal. Maybe I could take this medication for spastic colon, or I could take, progesterone or some kind of fertility treatment, or I could monitor my heart rate with a Holter monitor, but not how do I actually fix it. And so that's what my job is, to teach you what to do at what time, how to correct it, and how not to lose time and money. Now, you can research a little bit more about Healing with Excellence by Googling. You can see some of our reviews, and then you can also go to the About page. So in the beginning, I have to start with the basics, the foundations to healing. I have to do a neuromuscular assessment to see which muscles are talking to the brain at the right time and what's not working correctly in the neuromuscular system. I have to look at those daily stressors. I have to help you understand your body composition, like your lean body mass, your bone, your organs, your healthy tissue, and then your body composition as far as how do you increase lean body mass and decrease body fat if that's necessary. Sometimes that's not even necessary. And then also I look at like what are those daily lifestyle stressors and what do we need to correct quickly? What's impeding that healing process for you? So we address those basics first. And then as the foundation is addressed, if there's anything more advanced I need to add in, I can. So I do additional therapies like neurofrequency, massage therapy, laser therapy. There's specialized tools I use for biofeedback, something called the Zyto scan, and Psych-K to help with rewriting the subconscious mind, something called EVOX and heart rate variability. There is where we can track your heart rate and kind of see where there's discrepancies in the body and in the nervous system. So there's so many other things that I add on after we address the foundation, if it's needed. Some people, it's simple. It's 2 or 3 sessions and everything's corrected, like a pelvic floor problem or a low back pain issue. Other individuals that are dealing with a chronic diagnosis like chronic Epstein-Barr virus or Lyme's disease. Now, it doesn't mean that you're going to be in my office all that time, because most of your healing is going to happen at home. I'm just going to be your advocate to help you through the process and teach you what to do at home effectively so that you don't lose time. Now, just to show you, if you go to the website and you learn about the different services, the wellness evaluation or the international wellness team evaluation, if you're doing a private evaluation with me, you'll see that evaluation is $399. And some people are scared because they've been to other practitioners that maybe there's an initial evaluation, and then at that evaluation, they'll say, okay, your care plan is $6,000 or $8,000. That does not happen here. You do that initial evaluation with me and you leave with a solution. You leave with a plan to start following at home, to start taking care of yourself. And that $399, even though that might sound low, is like having me on retainer. Once I know what you're going through and I've done that full assessment, in between that initial session and any follow-up session that you need, you can answer or ask questions at any time. I have a private group. You can text me. You can send an email to make sure that you're not losing time, because you're doing a little bit in my office, but then whatever you're doing at home and at work or in your life is what's going to either accelerate our healing or decelerate it. And so I don't want you to lose time in between sessions. So once you've met with me for an initial evaluation, you can message for guidance throughout that time. And then typically the follow-up session is within 3 to 4 weeks to ensure we're on the right track. We do a new measurement of body composition. We do a new manual muscle test to make sure everything's doing as it should. And I track what you're feeling better with and what you're still having an obstacle with. So again, we might meet 4 times over 4 or 5 months. My goal is to meet you the least amount of times to get the greatest return, because the more appointments you have, the more money that's going out, the more time you do not have at home to take care of yourself, the less money you have to nourish yourself with, the longer it's going to delay the healing process. So I don't want you to have to meet with me every week unless absolutely necessary. If it's going to benefit you to meet with me weekly, that's what we're going to do. But the goal for me is to meet with you the least amount of times to get the greatest return and to ensure that you feel supported throughout that process. Now, some individuals work virtually with us with my international wellness team. The health evaluation is $4.99. And I still do the initial intake, but other professionals are on the call to assess what's happening so that they can help support you too. That's not just me looking at the case. So we might have a nurse practitioner, a physical therapist, a licensed mental health counselor, also viewing what you're going through so that they can be my backup team to support you. So I have 2 different options where you can meet with me one-on-one, or you can meet with the team as a whole, and each of us will support you to ensure that you're going through that healing process. So I recommend browsing the website, seeing what's available. I have private sessions available, certification programs, and I have smaller workshops. Like if you're not ready for something as deep as a wellness evaluation for you, you can start learning about your blood chemistry, how to read your labs and to correct them on your own, how to address a vitamin deficiency, or what's the right test to do for that. So I have workshops to help you if you're not ready to jump in for your personal wellness evaluation. But I can tell you, once you learn how your own body works, it saves you so much time, money, and energy that honestly your healthcare cost and your lost time drastically decrease. It comes to sometimes almost zero. And that's the goal of when you're meeting with me. So you can go through, browse through the website. Again, you can Google to read the reviews. And then also you can go to the YouTube channel. The YouTube channel has so many videos there, shorts and tips, so many things that you could do to start improving your life. And again, you could listen to the shorter things, or you could listen to the longer videos that I have. And then, of course, if you Google Healing with Excellence podcast, I have multiple podcasts on Apple, Spotify, Buzzsprout, whatever your favorite platform is. But my goal is to share that there's so many answers to healing if the right modality is addressed at the right time, and if someone's looking at the whole picture. Because I know when I had multiple specialists, nobody was talking to each other, nobody was looking at the root cause, and so the puzzle could never get complete because everybody was working independently of themselves and just looking at pieces of my body, like just my heart, just my reproductive tract, versus understanding that everything worked together. How I was eating, how I was thinking, how I was breathing, how I was exercising, each of those choices and actions that I was doing, and again, some of them innocent mistakes, were creating a poor outcome for me. So if you would like to learn a little bit more about what your body needs to regulate itself and how to address the root cause, and you'd like to have an advocate, a general contractor, look at the whole project and help put it together for you, even to help you communicate effectively with your physicians or the hospital, this is probably the plan for you. Reach out to me if you have more questions. Again, do your research. I have multiple references and referrals that will reach out to you and help you if you need any advice or extra confirmation about a specific ailment that you're dealing with. Either way, I look forward to supporting you and serving you, and I do believe it'll be a completely different experience than anything you have encountered thus far through your healing journey. Thank you so much. And again, feel free to message me anytime. Have a great day.